Hello everyone. Today's the topic is hypertension. What is hypertension? Hypertension is high blood pressure. Okay. So in nowadays in our family, my family or your family, in every family we got a patient having hypertension. So what is the definition? Definition of hypertension is it is also known as high blood pressure. It is a condition. Okay, it's not a disease, it's a condition. It is a condition in which persistently rise blood pressure. What is that? Persistently rise blood pressure. As I told in the previous class, if the blood pressure, systolic blood pressure, that is systolic and the diastolic, if the pressure is, if the systolic pressure is more than 130 mmHg and the diastolic 90 mmHg or more than that, okay, that case are considered as a hypertensive. So this hypertension is a serious medical conditions. It's also increase the risk of heart, brain, kidney and other diseases also. So what are the signs symptoms? In severe case, extremely high blood pressure, in that case you see the following signs symptoms like severe headache, nose bleed, bleeding in urine, confusion, vision problem, chest pain and irregular heartbeats and difficulty in breathing also. These are the sign symptoms. So the next one is, that is pathophysiology. What is pathophysiology? Pathophysiology is the mechanisms that is created by our body, which the body control our blood pressure in blood pressure level. So what are there? One is Baroreceptor Reflex. One mechanism, Baroreceptor Reflex. Another is Renin Angiotensin Reflex. Next is natriuretic and sodium and water exchange balance. So the blood pressure is increases by blood pressure is also the product of cardiac output and the peripheral resistance. If there is increase of cardiac output, that leads to rise in blood pressure. If there is any peripheral resistance to the arterial, arteries, that also leads to rise in blood pressures. So I will discuss the first one, that is the baroreceptor reflex. What is baroreceptor reflex? First we have to know about what is the baroreceptor. Baroreceptors are the nerve endings that are present on the arch of aorta. See, this is arch of aorta. In previous class we discussed about what is arch of aorta. So aorta is the first blood it is the first artery from which the blood is circulated to the other part of the body. So the arch of aorta, here the arch of aorta, there are several branches are started from this several branches are openings are there. So this one is called the left subclavian, this one is the left carotid, and look, in this one is called right, as it is present in the right side, right brachiocephalic. Okay, from this right brachiocephalic there are two branches is opening there, that is right carotid and right subclavian. Right subclavian and right carotid. It is one of the questions comes in objective type question come in exam, that left subclavian and left carotid is directly is the opening from the aorta, but the right subclavian and right carotid, it arises from the right brachiocephalic artery. Okay, so this pointed part is called the baroreceptor. These are the baroreceptor or the nerve ending present in the arch of aorta. What's its role? It's the pressure. It's observe the pressure. If the arterial pressure is rises, increases, the baroreceptors, what's it's called? It gives impulses to brain. This is the brain that control the blood pressure cardiovascular center, that is medulla oblongata. This synthesis, this gives the nerve impulse, that is sympathetic nerve and parasympathetic nerve. So, as the impulse goes from this arch of from the baroreceptor, when it first detect the rise in blood pressure in the artery, that give a sensation, that is impulses sent to the brain. In brain, the cardiovascular center is where the regulation of the cardiovascular system under the control of medulla oblongata. From this medulla oblongata, it send the impulses to the sympathetic nerve and the parasympathetic nerve. What happens if what are the role of parasympathetic nerves and the sympathetic nerves? See this flow chart. As the baroreceptor, the blood pressure increases, detect the rise in blood pressure. So the activation of the baroreceptor on the archofaorta, then the increased afferent impulses. See, this impulses is going to the brain, sent to the medulla oblongata, and the medulla oblongata's role is that it's activate activate the sympathetic and the parasympathetic nerve. When the rise in blood pressure increases, in that case, what happens? The increase in parasympathetic nerve. The activation of the parasympathetic nerve is occur. During the activation of the parasympathetic nerve, the sympathetic nerve activation it decreases. When the parasympathetic nerve is working, in that case, sympathetic nerve activation is decreases. So, its parasympathetic main role is to decrease cardiac output. What? The parasympathetic nerves works to decrease cardiac output. That leads to vasodilations. If the carotid decreases, so dilation of the vessels occur, and that's ultimately blood pressure level is decreases. Okay, as I told, if there is cardiac output product, it is the product of cardiac output and a peripheral resistance. So if there is cardiac output, it decreases. That leads to decrease in blood pressure. Okay. In opposite sides, if the blood pressure decreases, if the baroreceptor detect the blood pressure, the arterial blood pressure of this blood, then what happens? It similarly, it gives the impulses to the brain. Here, what happens? The baroreceptor is activation is decreases. Okay, so that leads to decrease in apparent impulses to the medulla oblongata. So the impulses that carry to the brain, that is called the afferent impulses, that is decreases. That happens. What happens? So the medulla oblongata activate the sympathetic nerve, and the activation of parasympathetic level is decreases. That leads to, as you know, the increase of parasympathetic nerve cause increased cardiac output and vasoconstriction. So that leads to blood pressure. If you see, you are drinking a cold drinks, if the through which you are sipping the through the pipe, if the pipe is very narrow, so we have to put pressure to sip the cold drinks. Similarly, if there is vasoconstriction in the arterial wall, so the heart has to work hard, so heart have to put more pressure, that leads to rise in blood pressure. This is the Bioreceptor Reflex. This is one of the mechanisms that's carried out in our body to control blood pressure. Another one is Renin Angiotensin 2. What is Renin and Angiotensin 2? Renin is an enzyme that is secreted from the kidney. It is a question come in our objective type question in our exam, competitive exam, that where the renin is secretion. Renin is secretion on the kidney, that is JG cell, Juxtaglomerular cell. This cell, particularly this cell, secretes renin. Renin is an enzyme to the blood. When it secretes renin, when the blood decrease in arterial pressure, the volume supplied to the blood volume that supplied to the kidney is decreases. So that case, the blood pressure, the arterial pressure decreases. That on this same time, the kidney secretes more renin to the blood. The renin, what is the role of the renin? Renin it's activate the angiotensinogen. Angiotensin is secretion on the liver. It is secreted, it is a plasma protein, it is secreted from the liver. Okay, it is also a hormone. Okay, so this enzyme and the hormone, by the action of enzyme, lock and key theory, you all know that enzyme and the hormone are activated to activate the reaction in the body. Again, this angiotensinogen hormone, what it do? It's activate the angiotensin-1. So during this time, when the level of angiotensin increases, there is a secretion from the lungs, that is angiotensin converting enzyme. Angiotensin, C for converting, E for enzyme. What this do? It's break, it's splitting, that is breaking, splitted angiotensin 1 to angiotensin 2. What is the role of angiotensin 2? Angiotensin 2 directly affect the blood vessels that cause vasoconstriction in the arterioles. So, if the vasoconstriction, as I told, there is lumen diameter is decreased or the narrowing of the path of the blood flow. So, that leads to arterial blood pressures. It's directly. In the indirectly way, it also affects, that is adrenal cortex. Here, with the adrenal cortex, you see adrenal cortex is present just above the kidney, that secrete aldosterone. The aldosterone level secreted from the adrenal cortex. So, this sodium, the aldosterone's main role is the exchange, the absorption of the sodium and the water in the glomerular filters in the kidney, where the water or the sodium absorption takes place, helps in the sodium and water reabsorption process. So, if the load aldosterone secretion, so the sodium reaction and the water reaction is more. Okay. The blood volume, if the water reaction is more in the volume, so that leads to rise in blood volume. If the blood volume rises, so that's in the space is same. If the volume is more, so it exerts a pressure on the in the wall of the heart muscles. Okay, so that leads to generate a pressure on the artery. That leads to rise in blood pressure. As I told, if the cardiac output increases, that leads one of the cause of the blood pressure. If the peripheral resistance is increases, that also leads to rise in blood pressure. So, in the angiotensin 1, what is called, it gives a resistance, that is vasoconstriction of the arterioles. So, rise in the peripheral resistance in the arteries, that leads to rise in blood pressure. And indirectly it will affect the kidney, that is the aldosterone, where its aldosterone is secreted. In that case, the aldosterone helps in the glomerular filtrations, that sodium reabsorption and water reabsorption. So, if the more water content in water reabsorption from the normal level, that leads to rise in blood volume. So, if the blood volume increases, the space is limited in the heart. The space is limited. It's occupy that much of blood in the chambers. If the blood volume increases, so it gives a pressure to the heart muscles. That ultimately it gives a rise in blood pressure in the arterioles. Thus, that leads to what? Rise in blood pressure. These are the few mechanisms that takes place in our body to regulate our blood pressure. Other two are also that helps to that's come under the regulation of the blood pressure, that is natriuretics and the sodium water exchange. Okay, this is all about the pathophysiology. Here in this video, the main topic is the pathophysiology. Okay, so for more video, you please give a like, subscribe my channel for more video. Okay, thank you.